is Nicole Charles. I'm an assistant professor of women and gender and sexuality studies at the University of Toronto, Mississauga in the Women and Gender Studies program in the Department of Historical Studies. During my undergraduate degree, I majored in international development with a minor in women studies and social studies of medicine. And across these really various disciplines and subject areas, what I was being introduced to was the interplay between local and global politics and the intersecting oppressions of gender, race, class, sexuality, and more. And towards the end of my degree, I was introduced more to the collective identity politics of women of color, feminists, scholars, and activists. And I was really inspired by their work toward less injurious worlds. And I knew I wanted to continue on with women and gender studies in my master's degree. And then that led to a PhD in women and gender studies. And here I am. Despite its presumed neutrality, technoscience, or the application of technology to science or scientific approaches to our interaction with technology, is in fact deeply relational and, of course, political. So, like science and the systems that uphold it, so these include things like white supremacy and patriarchy, technoscience really requires critical frames and rubrics to push back against these dangerous and hegemonic constructs. So my work is in conversation with critical, decolonial, Black, feminist, Indigenous technoscience scholars who have spoken against not only the Eurocentrism of so much technoscience, scholarly research and work, but also the US centrism of this work. And it asks what decolonial and specifically Afro-diasporic and Black systems of knowledge, and crucially, the plantation grounds of slavery in the Caribbean, can teach us about things like our dominant culture of care that really revolves around curative colonial logics, as well as our approaches to public health as they relate to racialized peoples. The HPV vaccine was first introduced in Barbados in 2014, and it was done through a school-based national immunization program that was open to girls ages 10 to 12. And unlike the traditional introduction of vaccines, which is done through public clinics by public health nurses, this rollout involved a lot of media. There were flyers, town hall meetings, parent-teacher associations. There was sensitization training from the pharmaceutical company directly, doctors from the Pan American Health Organization. There was a lot of frenzy around it. And this definitely raised citizens' suspicions about this vaccine. When the uptake rates were pretty low, the Ministry of Health tried to change their approach. So they opened up the age group beyond girls 10 to 12 years old, which also included opening the vaccine to boys should their parents specifically request it. And though the HPV vaccine is often marketed as a cervical cancer vaccine, HPV, high-risk strains of HPV can lead to genital warts, anal and penile cancers, head and neck cancers, and more. So really, it is not exclusively a cervical cancer vaccine. So the Ministry of Health tried to change its approach somewhat, but this still didn't lead to the uptake rates that the Ministry of Health had hoped. So eventually they decided to just scrap this school-based vaccination rollout, which was something that was modeled after international programs. So those in North America and Europe, which rolled out the vaccine through schools. And parents and nurses argued that this really wasn't suitable to the local population in any way, right? As I described, this was really atypical. So eventually, the Ministry of Health tried to routinize the HPV vaccine rollout by tacking it on to booster shots for things like diphtheria and tetanus that students had to get before they entered secondary school. And so this did increase vaccine uptake, But as parents I interviewed explained to me, this didn't necessarily remove suspicion around the vaccine. I guess I can start by saying that suspicion is an Afro-Barbadian vernacularized framing of this term vaccine hesitancy. It's something that Afro-Barbadian parents showed me while I was doing my research. So when I began this work in Barbados in 2015 to understand parents' ambivalence to the HPV vaccine, I found that many nurses and parents were using this adjective suspicious to describe their feelings toward the vaccine and how it was introduced to the public, which I just described. So I became really intrigued by this idea of suspicion and its relationship to the term hesitancy, which the WHO refers to as the delay or refusal of vaccines in the context of available immunization services. And I began to understand that this definition of hesitancy really excluded so many of the histories, such as histories of slavery, that suspicion encapsulated. And following my interlocutors, I came to understand suspicion as a corporeal trace or a residue, something that Deborah Gould refers to as an emotional pedagogy, right? That circulates within the various socioeconomic and political and cultural formulations and formations that contextualize the vaccine and growing assemblages of multinational pharmaceutical networks in post-colonial Barbados. While suspicion can't be neatly mapped onto other contexts, and nor should it, right? This is a very specific vernacularized framing of hesitancy in relationship to this particular vaccine and politics of race and sex and colonialism in Barbados. I think that its transnational offerings toward a different form of care are definitely very prominent, right? And this is essentially what Afro-Barbadian parents articulated is a different type of healthcare. So suspicion is not a no, and we can think of suspicion as a starting point, something that is very generative and asks of different types of questions toward care. So one which transparently engages with communities' concerns through things like participatory action research, a type of and model of care and public health that really engages and recognizes the inadequacy of biomedical models of care for many racialized folks and models more effective forms of disease prevention that happen all the time. So, not just during a pandemic when there is an agenda to promote a medical technology which warrants suspicion, right? And I think that failing to attend to these considerations ultimately diminishes the efficacy of public health efforts and continues to erode the public's trust in its governments and medical institutions. I am continuing on with my study of gender, race, and colonialism and public health in Barbados, and I'm going to be collaborating with Dr. Tanya Haynes at the University of the West Indies, Cave Hill, Barbados, on an interdisciplinary study that combines feminist theory, archival research, and arts-based methodologies to understand the racialized and gendered risk factors for type 2 diabetes on the island. So sugar is a central contributor to Barbados's emerging epidemic of type 2 diabetes. And this is a distinction that has really won the country a colloquial title of amputation capital of the world for its high incidence of diabetes related amputations. And while historians have made the connection between sugar in citizens' diets and the nutritional brutality that's associated with slavery, public health hasn't really taken up these ties between the colonial history and the prominence of diabetes, particularly for Barbadian women. And so we're really hoping to add this perspective to public health research and ultimately policy. When I began my PhD at the Women and Gender Studies Institute at the University of Toronto, I was fortunate enough to be among the last cohort of students of Jackie Alexander, who's a renowned transnational feminist scholar and activist. And it was from and alongside Jackie that I was really first introduced to the necessarily transformative politics of transnational feminist thought, which has really guided my research. As I went on to begin my doctoral research, I was co-supervised and mentored by Elisa Trotz and M. Murphy, who, have both been instrumental as well in guiding my scholarly trajectory in very different ways. They have very different but complementary styles, and who are now both amazing colleagues of mine in the Women and Gender Studies Institute, where I have a graduate appointment. They have been incredibly supportive as I made my way through the tenure track, modeling in important ways that balance between coaching and collaboration, which is something that I have taken on in my own graduate mentorship and that I continue to aspire toward in this role.